Hello again, it's Harry here, your geriatric nurse from Toronto, Canada. Back for more information dissemination for the care for the older adults and their caregivers. Tonight, I just wanted to briefly share a few of my personal experiences along the way as a geriatric nurse, a geriatric caregiver. Being one, I get exposed to different personalities, both with patients, families, coworkers, and this is so true in not only in our work life but also in our personal social life. And one of the things that hopefully we should have learned during the pandemic is to control what's within our reach, which is look inward, look to yourself, towards yourself, and because that's what you can control. So hopefully when we get exposed to different personalities, we get changed for the better, and hopefully not for the worse, because I've seen people go both ways. I always say, learn from the bad and take the good out from any experience. When we get exposed to challenging personalities in our patients, this is something very important to assess, because sometimes if there's something going on with their cognition, there may be a change in personality or sometimes an intensification of their baseline personality. So make sure you assess for that when you are assessing their cognition. Again, it will be helpful to have the timelines and what changes there were. This also brings to my mind the predisposition of people living with mental health conditions or congenital conditions, where they are also at higher risk of developing like cognitive conditions like dementia. And also when you're assessing for dementia with concurrent existing mental health condition or congenital conditions, sometimes it can be very tricky and challenging, because sometimes there would be already some challenging behaviors and things like that. Eh? So make sure you objectively assess and the timeline, what has changed. Also, what's very important when I assess those things is how it affects their daily life, their caregiver's life, what the possible triggers are, what the mitigating factors are, so that while they're in hospital or under our care, we'll be able to utilize those mitigating factors. And that's why when they're living with mental health conditions or congenital conditions which are lifelong, it's very important that they are compliant with their medical regimen, because I see a lot of cases where when people are compliant with their regimen, they're able to live a pretty full life. It's very important to also be cognizant of that fine line, making sure you are self-aware, leaving any baggage, personal baggage you may have at the door of the workplace and not bringing it in, because for you to be able to be fully available for the person you are caring for. When you are exposed to challenging personalities in your co-workers, that can make your work life very hard. I find that oftentimes talking to that person directly is more often than not is an effective way of dealing with it. But always follow the protocol in your workplace. There's always usually succession of what you can do, like your manager, so on and so forth. But hopefully, just by talking to them, you'll be able to fix things between the two of you. Um, this brings to my mind a line from Desiderata where it says, Always speak your truth quietly and clearly. So,